Hello and welcome to the Art of Medicine. Today's video covers how to recognize early signs of diabetes before its dangerous complications start. Diabetes is a chronic metabolic disease defined by elevated levels of blood sugar, which leads over time to serious damages to the heart, blood vessels, eyes, kidneys, and nerves. There are two well-known types of diabetes, type 1 and type 2. Type 2 is the most common type of diabetes, usually in adults, which occur when the body becomes resistant to insulin. In the past 3 decades, the prevalence of type 2 diabetes has risen dramatically in countries of all income levels. Type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition in which the pancreas produces little or no insulin by itself. Diabetes is a silent but dangerous disorder. Many people have diabetes for years without knowing, and during these years, diabetes silently damages many organs. Detecting it early can prevent serious complications. Symptoms of type 1 diabetes include the need to urinate often, thirst, constant hunger, weight loss, vision change, and fatigue. These symptoms may occur suddenly, especially in children. Symptoms of type 2 diabetes are generally similar to type 1, but are often less marked. As a result, the disease may be diagnosed several years after onset, after complications have already arisen. For this reason, it is important to be aware of risk factors. What are diabetes risk factors? Presence of family history of diabetes, being overweight or obese, being physically inactive, age more than 45. Anyone can develop diabetes, but these risk factors raise your chance. If you fall into any of these categories, consider getting screened. Blood tests can detect diabetes early, even before symptoms appear. The most well-known test is FPS, fasting blood sugar, that measures your blood glucose after not eating for at least 8 hours. Helps detect diabetes and prediabetes. The other test is hemoglobin A1C test that shows your average blood glucose over the last 2 or 3 months, useful for long-term diabetes monitoring and also diabetes diagnosis. The other test is oral glucose tolerance test, OGTT, measures how your body handles sugar after drinking a glucose solution, often used to diagnose diabetes and also gestational diabetes. That's a kind of diabetes that occurs during pregnancy. Type 1 diabetes cannot currently be prevented. There's no way. But effective approaches are available to prevent type 2 diabetes and to prevent the complications. These include policies and practices across the whole population and within specific settings like schools and workplaces that contribute to good health for everyone, regardless of whether they are diabetic, such as exercising regularly, eating healthy, avoid smoking, and controlling blood pressure and lipids. The starting point for living well with diabetes is often early diagnosis. The longer a person lives with undiagnosed and untreated diabetes, the worse their health outcomes are likely to be. Easy access to basic diagnostics such as a blood glucose test, FPS, should therefore be available in primary health care settings. Patients will need periodic specialist assessments or treatment for complications. A series of cost-effective interventions can improve patients' outcome regardless of what type of diabetes they have. These interventions include blood glucose control through a combination of diet, physical activity, and if necessary, medications, control of blood pressure and lipids to reduce cardiovascular risks and other complications, and regular screening for damage to the eyes, kidneys, feet, and feet to facilitate early treatment. Diabetes is manageable, especially when diagnosed early. Don't ignore the signs. Your future health depends on it. Thank you for watching this video and recognizing early signs of diabetes. Subscribe to the Art of Medicine for more accessible medical content.